Good morning to everyone, to Pepe Mejia, who joins us again today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 1,796 people are hospitalized in Cuba. 72 are under observation. There are 1,080 suspected cases and 644 confirmed active cases. Yesterday, we processed 7,588 samples in our various molecular biology laboratories. 2,417 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 900 in Havana's Hygiene, Epidemiology and Microbiology Center, 835 in Villa Claras, 280 in Santiago de Cubas, 675 in the Molecular Immunology Center, 534 in the Genetic Engineering and Biotechnology Center Lab, 397 in the Manuel Fajardo Hospital, 373 in the Naval Hospital, 338 in the Civil Defense Laboratories, 321 in the Fructuoso Rodriguez Hospital, 320 in the Hermanos Almajeres Hospital Laboratory, and 198 in the ICA laboratories. Of the samples processed, 31 tested positive for COVID-19. That's 31 people. This brings the total number of samples processed in the entire country since the pandemic began to 485,147, of which 4,684, or 0.97% of people, have tested positive for the virus. As I always mention, samples from all of the country's provinces and the Isle of Youth Special Municipality were tested. 569 from Pinar del Rio, 174 from Artemisa, 5,073 from Havana, 167 from Mayabeque, 156 from Cienfuegos, 206 from Villa Clara, 230 from Sancti Spiritus, 744 from Ciego de Ávila, 106 from Camagüey, and so on and so forth from all of the country's territories. Of the 31 positive cases diagnosed yesterday, 30 are Cubans and 1 is a foreign resident in the country. 26, or 83.9% of the 31 positive cases yesterday are confirmed case contacts. This means that 89% of all diagnosed cases in Cuba had contact with someone who had previously tested positive for the virus. This is the group at highest risk of infection, which is why all those who have had contact with a confirmed case are immediately traced, isolated, and tested. Of the 31 cases diagnosed yesterday, the source of infection linked to 5 is yet to be determined. This means that the source of infection in 80, or 1.7% of cases reported over the last 15 days, is still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 433. Of the 31 diagnosed cases yesterday, 16 are male for 49.7% of all cases, and 15 are female, representing 50.3% of all diagnosed cases on the island. 18, or 58.1% of the 31 cases yesterday were asymptomatic at the time of testing. Overall, therefore, 58.6% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 61.2% for cases over the last 15 days. By age group, 3 positive cases diagnosed yesterday are under the age of 20, 2 of which are under 18 years of age, for a total of 484 children or pediatric cases to have tested positive for the virus in the country. 415 of the 484, or 85.7%, have recovered from the virus and been discharged from hospital. Meanwhile, 13 people to have tested positive yesterday are between 20 and 39 years of age. 10 cases are between 40 and 59, and 5 are over the age of 60. Of the 31 cases diagnosed yesterday, 25 belong to Havana, 3 to Sancti Spiritus, 2 to Mayabeque, and 1 to Artemisa. The case from Artemisa belongs to the municipality of Candelaria. The 2 cases from Mayabeque belong to the municipalities of Nueva Paz and San José de las Lajas. Of the 3 cases diagnosed yesterday in Sancti Spiritus, 1 belongs to the municipality of the same name, 1 to Yaguajay, and the other to Trinidad. The 25 cases from Havana belong to the municipalities of Arroyo Naranjo with 5, 4 each to 10 de Octubre, Boyeros and Regla, 3 to Cotorro, and 1 each to Guanabacoa, La Lisa, Marianao, Centro Habana, and Plaza de la Revolución. Yesterday's results therefore mean that Ciego de Ávila has the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 35.92, slightly lower than yesterday. Havana follows with a rate of 20.47, also lower than yesterday. Artemisa has a rate of 13.98, then Matanzas with 3.61, Sancti Spiritus rate rises to 2.36, Mayabeque follows with 2.34, also slightly higher than yesterday. Then Pinar del Rio with 1.37, Cienfuegos with 0.49, and Las Tunas with 0.19. This means that Cuba's rate stands at 6.46 per 100,000 inhabitants over the last 15 days. To summarize, of the 4,684 people who have been diagnosed with the virus thus far in Cuba, 644 are active hospitalized cases. 623, or 96.7%, are clinically stable. Yesterday, no COVID-19 related deaths occurred in the country, meaning that the COVID-19 death toll on the island remains at 108, with a mortality rate of 2.3%, lower than the global rate of 3.21% and regional rate, which stands at 3.45%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 52 people were discharged from hospital, a positive result. This means that, to date, 3,930 people, or 83.9% of all confirmed cases in Cuba, have recovered from the virus. Today, 6 patients continue to be in a critical state, one of whom is being treated in Havana, another in Ciego de Ávila, and 4 in Camagüey. 15 patients are also reported as serious, 8 in Havana and 7 in Camagüey. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 316,953 people were diagnosed with the virus, for a total of 28,516,744 confirmed cases since the start of the pandemic. Yesterday, 5,927 people died of the virus, for a total of 916,005 COVID-19 fatalities and a mortality rate of 3.21%. The region of the Americas, which continues to be the epicenter of the pandemic and accounts for 51.65% of all cases worldwide, reported 134,889 new cases yesterday, for a total of 14,729,827 people to have been diagnosed with the virus. Meanwhile, 3,612 people died of the virus yesterday, for a death toll in the Americas of 509,509 and a mortality rate of 3.45%. The United States continues to top the list of countries worst affected by the pandemic, with 6,445,288 confirmed cases and 193,016 COVID-19 fatalities, of which 1,227 occurred yesterday. India follows with 4,659,984 cases and 77,472 fatalities, with 1,201 reported yesterday. Then Brazil with 4,282,164 confirmed cases and 130,396 deaths, of which 874 occurred yesterday. Russia comes in 4th place with 1,051,874 cases and 18,365 COVID-19 related deaths, with 102 reported yesterday. Next comes Peru, then Colombia, Mexico, Argentina, Chile, all countries from our region, followed by Canada, Bolivia, and Ecuador, with high numbers of confirmed cases and COVID-19 fatalities. In Mexico, for example, 534 people died of the virus yesterday, for a total of 70,183 COVID-19 related fatalities. This is the information that we have on the behavior of the pandemic in Cuba and the world.